Good evening, members. Karibuni sana. My name is Dr. Theuri from KHF, and thank you for joining us today evening. On the call with us, we do have Joy, who will be taking us through some uh, updates that are happening to the system and some training on the system use as well. And we'll take it from there. I have a couple of updates for those who've joined in today, and I'll first begin by asking if we have anyone from SHA or the ministry. If you're with us here, the meeting is in webinar format, so please lift up your hand so that I can see that on the chat and possibly upgrade you to a panelist for conversation purposes. If we do have leadership from RUFA, CAF, Chuck, KCCB, and SUP came here with us as well. Please lift up your hand. We'll see that and do the necessary on the back end. Today, indeed, we did have a meeting with the SHA leadership led by Dr. Abdi, the chairman, the CEO, the director, beneficiary, and provider management. We did have the director of ICT, the director of corporate services present, a team that is piloting at the KNH hospital, as well as the principal secretary for State Department for Medical Services. From the providers, we were ably led by Dr. Gakombe, our chairman, and we had representation from RUFA through Dr. Lishenga, CAF through Dr. Musau. KCCB, we had their vice chairman, James Minor, and Mukua Moses in the room with us. We also had, I believe, the CEO of RUFA as well, Cynthia Munene. Among the things that we requested, and I don't want to believe a presser was done to this effect, was that one, we will have a soft rollback to HICS for verification and identification of our clients the moment they come to our facilities. This is to enable us go through that step. All patients who are admitted before 30th will still be discharged on the HICS platform, but anyone else, I think discharge is happening through the SHA portal. Joy is going to give a little insight on that. The second thing was that for managed schemes, the end-to-end is being done on the SHA portal. For managed schemes, the end-to-end is being done on the SHA portal. Sorry, the HICS portal, end-to-end for managed schemes. The civil servants, the police, and whatnot, that is being done on the HICS platform. The other thing was right now it's OTP that is being used for verification. Biometric is being added a little later. I believe Joy will also give that. Kindly let us give the ICT people or the people handling the system to fill in the document that has been circulated by SHA so that they can receive the credentials. We've agreed on a turnaround time of less than less than 24 hours on this. So let us ensure that we have that in place. E-contracting, the law only allows for e-contracting, so the manual contracts are a stopgap measure. So once the contract portal is up as well, we shall have to go there and tick so that we are compliant with the law. We agreed on a turnaround time that ends on Tuesday of this coming week, rather. Today is Sunday, the week has begun, so we shall have the week Tuesday to submit those contracts. Capitation is a big issue for especially level 2 and 3. So all registered Kenyans on SHA will automatically be eligible for capitation at those facilities and select level 4 facilities. So select level 4 facilities and 2 and 3 automatically will be eligible for capitation. 5 and 6 that were offering capitation, we were told it's a hard no. So any patient or any facility that is currently doing capitation and a client comes, we were kindly requested for them to visit the nearest level 2 or 3 facility. On the same, HICS is being used to identify the same people for on capitation. And there are two models here. We shall use the global, there is a global budget model and the capitation model. In the interim for the next 90 days, we shall use capitation. And we have a team that we have donated to SHA as well to rework the nitty-gritties of capitation. Tied to that, the current rates that will apply are the SHA rates on the capitation model, which I think is about 225 per quarter per client. Returns, we encourage to send returns as well, those who are doing capitation, unless there's a different update, but that is what we agreed on today. And we're also going to streamline the referral system. As of now, if you're a level 4-5 facility and a patient shows up, unfortunately for the patient, they would have to do an out-of-pocket expenditure. However, if they are due for surgery and the doctor deems it fit for them to have surgery, the SHA benefits will trigger and they can apply for surgery and authorization is happening. As of now, no pre-authorization, but authorization is what is happening. A call center has been set up and we are trying to work a way that we have some representatives from the provider side who we've asked to be trained a little more, and there will be the link between us and SHA. However, for some of the high volume facilities, please send me your ICT people so that we can have them on the white list for them to receive direct access on the 147 number. Communication between HQ and branches, we asked for this to be streamlined, and we do understand, of course, there are some culture changes that need to happen as we move to SHA. So this is one of the things that is being worked on. The other thing was on money. Money, of course, was a hot topic, and we have agreed with the principal secretary that the ministerial state departments, with the direction from the head of public service, was that they should ensure that immediate remittance has been done to NHIF and now SHA, sorry, to SHA for them now to pay providers. In the law, SHA cannot keep any money, even in an interest earning account. Therefore, it doesn't make sense for them to keep any money. Money will be paid directly to providers. Manual claims, in the previous meeting we had with the CEO late last week, he said in the interim, there shall be some manual elements of this claim. And we said that previously claims have failed to be paid, even valid claims. So we want some protection around this. And one of the things that was agreed on is a communique or a memo from the CEO that tells us of the minimum document pack that will be required by providers, so nothing is lost in translation. And we also agreed that these claims for the interim period between first and until where the system is properly up will be given preferential treatment when it comes to payment. So this will be paid first so that we still work fresh with the memory we have around this time. KHF will also be will co-chair the committee that is handling the legacy debt, so that we are able to work together with the PS for medical services. I will speak a bit about capitation again and the global budget model. So a national pool, and we need to get money now down to the facilities. How does that happen? It will be population based. So a particular PCN will receive allocation for the population that they serve, and this population, the number of facilities will be the denominator. So if you see this number of patients, then you get the money. However, it works slightly different because there are some weights that are being used to assign the payment due, and one of them is the visit, and the other one is utilization and it's weighted against utilization and cost of care as well, so that if it is profitable for a facility, for example, to give X-ray services and get more patients, we don't have that kind of adverse selection that disadvantages the system. That is what we were told. Nor do you get to chase away patients who you think will consume much of the money. So it has those safeguards. So we have donated a team, like we said, to work with the advisors of this and the actuaries, so that we are able to arrive on a model that is not only practical, but works for the people who are coming to seek care from our facilities and from us. I think that is much of what I think I can update as of now. Linda Mama is being handled again a little different. They need to register. The ladies need to register for sure. And anyone who's coming for ANC, ensure they register. Anyone who's coming for ANC, please ensure that they register. I think those are the updates as of now. Joy will deal with the rest of the talk. We will request that you use the Q&A section for your questions, so that they are able to be tackled in the chat. Conversation can be ongoing. However, if you do ask a question there, you run a risk of it being overtaken by conversation. So please use the Q&A for the questions you may have today. Thank you. That is it from my desk. To the 200 of you who are here today, asanteni sana, and Joy, over to you.
All right. Thank you, Dr. Tim. Good evening, everyone. My name is Joy Kiguta, and I will be taking you through the SHA provider portal so that you can get an understanding of what is expected of you as a facility when a patient comes to your facility. So allow me to share my screen, and then we can take it off. All right. So this is the provider portal. Just give me a second. And the URL for you to be able to access the portal is portal.sha.go.ke. And with this, you're able to access the portal. Now, when you put in this URL, the first page that you'll be able to see is how you can contact the SHA team in case you're having any challenge. So you can either call them or send them an email on the email address provided. The other thing that you should know is that you are able to access any more information regarding SHA from their website once you click the Learn More tab. Then I will just take you through what happens once you log in. So to log in, you'll be asked to enter your email and password. We've already started the process of sending out credentials. We have also circulated a Google form for you to be able to enter the details of the different users within your facility so that we can quickly onboard them and create their accounts onto this platform. So what I suggest is, if you've not yet gotten your credentials, kindly fill in the form that has been going around in the different groups. It was shared earlier on today. And as Dr. Tim has said, we are working with a turnaround time of around 24 hours at the maximum for you to get your credentials. If you've gotten your credentials and you're not able to still log in, there is the provision on the form where you can ask you can just let us know that you already had an account and you're still having a challenge to access it. And then we can look into what the problem is and possibly reach out to you via email. So what I will do right now is just log in to the portal. I'll use my credentials and get right into the portal. So the purpose of this portal at this moment in time is for you to be able to authorize any patient who comes to your facility. So how you quickly look them up and then start a visit against an intervention. I will take you through the portal as is. So once you log in, the first page that you'll see is the eligibility lookup screen. So this is where you'll do the actual search. On the extreme top right, you will see your user credentials. So your name, the name that you have given for you to be identified as. It could be your individual name or your facility name, depending on what how you operate as a facility. The other thing that you should be able to see is the name of your facility. In this case, mine is Test Facility. Then the other thing that you should be able to see is the help button. So here is where you will get more details on how you can get any help if you're stuck at any one point or another while providing service to the patients. So as I said, you can send an email to customerservice@sha.go.ke or call the number that is on the screen. Then the other thing that we advise is for you to download AnyDesk. So in case you're having any system challenge, we can be able to see what is on your screen and troubleshoot it for you as fast as possible. So it is good to do this well in advance so that when you call, we're able to troubleshoot faster with the different teams. Then I have zoomed in, I have maximized my screen, but on the usual, I can show you how it looks like on the usual screen. On the actual size, you will see a menu bar on the extreme left that has various functionalities. At the moment, what we will focus on is the dashboard, eligibility, visits, authorizations. Then what we're hoping to roll out starting tomorrow and in the coming week is the ability to raise a pre-authorization and also how to submit invoices based on the invoices or claims based on the visits that have occurred and how those will get onto the SHA side of things. So for now, for today, what we'll be focusing on is eligibility, visits, and authorizations. So let me just zoom back in so that it is very clear for everyone. Okay, so now on the page, what you should be able to see is how to search for a member. So in this case, what we advise is when the patient comes in, you're asked to get their ID, and then you can read out, you can get their ID number. So in this case, for this training, I will use my personal ID so that we can get that information. So once you search for the member, the membership details should be able to populate. So in this case, you can see my details, my name, my ID number, and my validity. So the next thing that you should be able to do is to click view, where you'll be able to see more information about the patient who has come to your facility. So in this case, you're able to see the gender, the date of birth, and the validity. And you're also able to see if the person that you have searched for is the principal or not. Then the other thing that is critical is to see the member contribution status. So what we have been able to do so far is get a link with Afya Yangu. So whatever information is being populated on the Afya Yangu portal, we're able to pull that information, and soon you should be able to see whether someone is actually active or not, if they're paid up or not. For now, as people are continuing to contribute, this page will just show whether someone has completed the assessment records or through the forms on Afya Yangu, or they have completed their profile. In this case, I have not completed my profile, so this information is not complete. So once it's complete and I've filled in the assessment forms and I've started contributing, then the information should be different here. Then the other thing that you should be able to see is the different packages as set out. So the packages shown here are modeled to the benefit packages. So you're able to see the different packages, and then you should be able to drill down to sub packages and interventions. I will take you through that in just a bit. Then the other thing you should be able to see on this page is the dependents. At this point, for myself, I have no listed dependents, so this is blank. Once an individual has completed all the information on Afya Yangu and added their dependents, then this information should be able to populate, and you can have an action of viewing the information about the dependents. So now going back into the packages, assuming that Joy has come to a level 2 or 3 facility and she's seeking outpatient services, what you'll do is just go to the package outpatient services, and then you should only be able to see the sub packages or the interventions that are related to the level of facility you are. So in this case, since I'm a test facility, I'm seeing all the benefits, all the packages, all the sub packages, and the interventions. But dependent on the level of facility you are, the information you will see is different from another facility. So let's say we're still level 2 or level 3. And the patient Joy has come for outpatient services. So I'm going to pick outpatient PHC and view the interventions against that. So this is what is within the benefit package, and you're able to see the different interventions under the outpatient sub-package for PHC. So within this, depending on why exactly the patient came, you're able to pick the intervention that you want to start a visit against. So for example, Joy has just come, she's not feeling well, so you'll take the consultation, diagnosis, and treatment intervention and admit. So this will push your patient into the queue, and you can be able to start a visit against them. So here you will see that you're being asked to confirm that you really want to start a visit for Joy, and then you're able to see the benefit you're charging against and the benefit code. So to start a visit and how you verify the patient is authorizing their visit. There are 3 modes of authorization. So we do have a one-time PIN. So if the member has registered their phone number, then the one-time PIN is sent to their phone for them to authorize their visit. If for one reason or another, the patient is not able to give a one-time PIN, we do have a bypass method where you can request for an authorization from SHA. So this is not a pre-authorization. This is just in case of an emergency or you're not able to get the OTP. Then the final one, which we're going to roll out in the coming days, is biometrics. So how do you authorize a patient via biometrics? But for the purpose of this webinar, what I will take you through is just the one-time PIN mode and SHA authorization. So in this case, Joy has already given her information and we can be able to see her contact. So what she'll do to start the visit or to authorize the visit, you'd use this contact to authenticate her visit. So I will send an OTP will be sent to her number or the patient's number, and you can use that to authenticate. So the patient should get an SMS from SHA portal as the user with the one-time PIN. So the message would read, "Dear patient, your SHA OTP is whatever it is. In this case, mine is 647672. So you verify your one-time PIN at that point. Whatever PIN has been given by the patient is what you'll put in there and verify. Then at that point, a visit has been started for the patient. And this should be basically it for a patient who has come to your facility. The other thing, as I said, that we're going to roll out is how to submit a claim. So once we get to the point of submitting claims, I will take you through this screen. But for now, what we wanted to do was just start the visit against a particular patient, against a particular benefits sub-package, and a specific intervention. So now if you want to get more information about the visits that have happened in your facility for a given date and time, you're able to see all the information. So for example, we have this visits that have happened, let's say today. So you can see the date, the timestamp, the scheme, and then the branch where if you're sitting at, let's say, the head office and you have multiple branches, you could see visits for different different branches. But if you are sitting, if you only have one branch and you're seeing information for only one branch, then it will just say the name of your branch. Then you can also see the status of authorization. In this case, it is authorized. So that is it in terms of how a visit is seen, how you can see a patient, and how you can retrieve that information later on. Then the other thing is you can be able to pull this information in terms of authorizations only. So if you want to pull authorizations for a certain date, then all you need to do is come click all authorizations that have been run, and then you can click for a specific date. So from, let's say, today only, if you wanted to see today's authorizations only, so you pick the start date as today and the end date is today. Then if you want to filter by the type of authorization, whether it is one-time PIN or SHA authorized, then you're able to pick that information. So once you fill in this form, you're able to filter. And then the other thing is you can export whatever data is on this page to your email for future records. So let's take another example. If Joy, your patient, came in and she was not able to authorize via a one-time PIN and you're requesting for a bypass, how does that process look like? So we'll once again search for Joy on the search screen, and then the information will populate here. Then you'll see the information, as I said, the biodetails information. Then also remember that as the days progress and people continue contributing towards SHA, then we should be able to see this information changing. So you'll be able to see if a member is paid up or not, or we'll just put it simply in terms of them being active or not. Then here, as I said, you're able to see the packages and the you can drill down to sub packages and interventions. Then the other information that you will see is the dependents under the principal member who is above here. So let's take the case of, for example, Joy has come for an inpatient service. So you click the inpatient package, and if the patient has come for, let's say, inpatient critical care, you can click the interventions under that. And then you'll admit, or we can use a different one. They've come just for a normal inpatient case. So inpatient. And then you say, for example, it's management of medical cases. And the access point for this is definitely inpatient. And as Dr. Tim said, we have put all packages and sub-packages. They do not require pre-authorization at this time, but this will soon change as time progresses and will enable pre-authorizations to be lodged on the platform. So in this case, Joy, we need to admit Joy. So we'll click admit and she will be admitted. So we have said that Joy cannot authorize her visit via OTP, so we need a bypass. So we'll click on SHA authorized. So for this SHA authorized screen, as we have said here very clearly, it is mandatory to send a reason and a brief note to SHA to approve this visit for the member. So the location information will be definitely where we're at, where you've logged in from. Then for the reason for the request, for example, you can say it is an emergency, and then you say, you need to give a reason, you need to give a note to SHA as to why you're bypassing the one-time PIN. So here you could say patient is unable to come to the front office desk or something like that, or they're unconscious. Whatever the reason could be, you need to put it there. You just give a note. And then we also ask for a supporting document. So in this case, it would be the patient ID. We have had questions of what if the patient came unconscious and you can't access their ID, what else would you put? So we would say a brief note would be necessary for this. So let's attach a document that will be used. And then now you start a visit. So at this point, your patient has been admitted and you can continue offering care. So when you go to see now the visits or the authorizations, whichever way you want to go in, let's go to authorize visits. So you'll see the pending visits and how they were authorized. So you'll be able to see that particular visit is also on the screen. And you'll see that the mode of authorization is through pair authorization. So you should be able to follow the same process as was there initially for a one-time PIN patient. So in short, just to take you through what we're able to do right now and what we want to do in the near future. So right now, what you should be able to do is come search for your patient who has come to your facility via their ID number. You'll be able to see their bio details in terms of date of birth, their gender, and then below you'll be able to see the benefit packages based on your level of facility. And then you'll also see the dependents. After that, what you'll do is you'll start a visit against that particular patient against the particular intervention. So just the process I have taken you through. So for now, that is the scope of what you should be able to do on the platform. In the coming days, we will also roll out starting a visit or authorizing a visit with biometrics, and we will take you through what that process looks like. Then the other thing is we will take you through the process of how you can get a pre-authorization from SHA using the portal as opposed to email or phone call. But for now, we have removed for all the benefits, for all the packages and the sub-packages and the interventions, we have removed the need for pre-authorization, but that should change in the coming day. And also what we're going to work on is how to submit the claims. So dependent on the level of facility you are, there'll be different ways to submit a claim, and we'll have a very targeted approach when we come to those trainings. So in short, that is what you're able to do on the platform. And I'm happy to answer any questions that may arise as we move along.
That is it, Joy?
Yeah, that's it.
Right now. Great. There are some questions on the Q&A. Please take on those. Can you see the Q&A on your end?
Yeah, I can see them.
Yeah. So just take on those and then just click on the answer live as you move, and then we'll see what we'll be left with.
Okay.
Okay.
Okay. There's a lot of capitation questions, Tim.
It's because most of the facilities definitely are level 2 and 3.
Yeah.
That's a band we see. Do you have anything on that yourself?
No.
Okay. All right. So I will get some answers for that. Just to move to the next question. Just leave the capitation out first.
Okay, so I see, does the SHA portal allow multiple logins? Yes, so if you have different users using the portal, you can be able to log in at the same time. So it does allow for multiple logins, but the portal logs you out after a specific amount of time just because of security purposes. Will the system give a unique authorization code which providers can capture their billing system? Yes, we do have a unique authorization code. I can take you through that just in a bit. Let me share my screen again. So if you look at the authorizations, there's a code here or a token which you can be able to copy into your system. So this token is unique and is generated for all visits. You can also click here to copy the token and enter it into your HMS or your EMR system. Let's see. So in terms of what you do when you're providing services, so for now you can just provide the services, then the claiming bit should be in less than a week. So it's not in the coming weeks, it's tomorrow, Tuesday, you should be able to submit a claim on the platform. So continue offering services and then you'll be able to submit the claims at a later date. So for the training session, we do have a video guide that will be shared, and we can post this on different channels so that we can be able to refresh your minds and also have it easily accessible. So we have a video guide and also a written guide that you can be able to walk through. So for those who have not been able to receive credentials, please use the form that had been shared in the group so that we can be able to pick up that information quickly and set you up. As Dr. Tim said, we are taking less than 24 hours for you to get your credentials. If there's any challenge with the credentials that have been issued, there's also the bit where you can say that you are asking, you had already received credentials and there was an issue, then we can quickly pick that up. Also, you can reach out to the SHA offices so that the phone number and the email address I had shared earlier, you can reach out to them and they should be able to assist. Just looking through the questions. Your inpatient in the visit still reads as an outpatient. We'll look into that and make the change on our end. I have taken note of that. I can see some questions about adding dependents. We'll tackle that in the next session, I think, with Dr. Tim. How do you add dependents as well? Yes, so the process of starting out patient visit, it's what I had started with. It's the same as starting an inpatient visit. So you just search for the member on the portal and then you start a visit against the interventions that you are starting, the patient is going to get. So just look at the outpatient package, then drill down to the sub package and then into the interventions. So for now, the process of discharging the patient is not there. So we will get into that. There's a release that will be made tonight that will capture that information on how to discharge a patient. So to go about a surgical case, so you'll do the same. So the process is more or less the same for all patients. So you just come, search for the member. Get the information. Scroll down, and then you choose what what package and the sub package you'd want. So if it's a surgical service, you click the surgical package, and then you'll see the sub packages. If it's general surgery, but then you also need to be very careful to see that you're looking at where it can be received, whether it's outpatient or inpatient. You need to be very clear on what the access point is. So for example, if it's a general surgery that is being accessed within inpatient, you can click the interventions against that, and then you choose the particular intervention. So dependent on why the patient is there, you will be able to get that information. So for now, you should be able to see patients with the information that is provided on the platform. So I think Dr. Tim had mentioned about the contributions and how you should still see patients, so not turning away any patient who comes to your facility. Then when it comes to the point of claim, you'll put all necessary information and submit the claim. We will share the credentials for the form for applications for credentials so that you can add yours there. Okay, I think I've answered most of the questions that are in the Q&A that are related to the claims portal, Dr. Tim.
Right, thank you. Just a quick note to everyone in attendance. We are taking this in phases and in bite-sized chunks. Possibly this ends up being a very technical update as Joy has done on the policy matters that are related to some of the discussions ongoing. And top of that has been PCNs because the global budget model for financing it is where SHA is going and moving away from the capitation. That needs some tweaking as we agreed on conversations today. So for that, I will request your patience on it, and possibly tomorrow, I hope, Joy, we can run a similar engagement or training. I will for sure have some more answers since we've seconded someone from the Healthcare Financing Committee of KHF, as well as Rufa has Brian there. They will come back with a few more answers around this. There was a question that was asked by my good friend Marcy, which is, Joy, this I'll throw it to you. A patient who comes in an emergency setting and is basically unidentifiable, how do you proceed? Please take that, and then I will see how to answer the rest that I see on the chat.
That's a good question, and that's a case we had not taken into consideration, because the only way you can start a visit is against the identification information provided. So if you do not have any identification information, you're not able to bypass the starting of a visit. So allow me to just check with my colleagues and then I can answer that.
All right, thank you. I can see on how do you see patients patients yet they're not paid up? Will reimbursements be done for non-paid up citizens? Will facilities end up losing money? The model is your patient has to be registered. That's the first thing we've been told to ask patients to do. Patient must be registered on the portal. Those who are in the informal sector without a pay slip, there's the mean testing part of it. They will fill that, assign a premium, and then they can proceed. That is from that's for Kevin Maweu. Renal patients, do we continue offering dialysis? I believe they're one of the categories that are easier to identify for sure. Just ask them to register and the benefits will trigger. SHA did indeed say today for patients who may have done an out-of-pocket expense for a benefit that was due to them, please apply them with the necessary documents and they will reach out to SHA for a reimbursement. That was also brought out. Joy, do we have a standard claim form? As of now, we are on HICS. That's what we are using, or the old. There's a gazetted SHA claim form. I don't know whether we're on that yet. Joy, are we on that?
No, not yet. From our discussions yesterday with SHA, what we had is they were still creating the new ones.
All right. Dennis, Othiambo, capitation reimbursement payment will be based on disease weight and frequency of visit. Will facilities be paid on fee-for-service model within PCN? In the strict sense of that question, it ends up being sort of it's a hybrid between fee-for-service and capitation because of the weight lines that the actuarial team is using. So on this one, like I said, I'm requesting for some patience so that we can have a detailed explanation on it from the team at SHA. Please comment on, I think, an interesting question here. Credentials, but requires location. So are the credentials geotagged, Joy, or geolocked, if I may call it that?
Yes, so the credentials we're giving are for specific locations. So they're tagged to a location. So it would be important to get that so that when you log in, you're mapped to the correct location.
Fair enough. And this is for facilities with many branches as well. Do you take care of that? And the second question is, are there various rights for different users within possibly like a big facility, like a super admin who assigns the various departments some rights?
Yes, so there are different rights. Even in the form that we have shared, you need to specify if you're, for example, IT, if you're front office, if you're back office, if you are the administrator and such like things. So we do give rights based on what functionality you will be using on the portal. Then the other thing is, as we move along, we'll also create the super admin for facilities who can be able to add other users. But for now, we're controlling the user addition so that things move faster.
All right. The other question is on authorization and pre-authorization. I think I want to make it clear there is no pre-auth once you come to the SHA portal, is only authorization because the ported data is deemed to be quite okay from the explanation they give, and that is what indeed we do have. There are level 3B hospitals that have infrastructure and capacity to offer advanced medical services and procedures. Will SHA consider this service for provision? Now, what is being considered is the KMPDC guidelines on facility categorization. And I do indeed sit on the board of KMPDC, and what is coming out is a need to relook that categorization so that we are able to fine tune it to the needs of the country. So For sure, that may come a little later once we're done with the SHA rollout, but that is being relooked into, Anthony. Consensus on co-charging and co-payment, that is there for sure, and we are it is in the contract. So we hope to see the clarifications of this as well will be brought out once we are done with the contracting cycle. But they are there. The benefits that can take co-payment, that has been clearly stated in the contracts. Explain again what should happen in the coming weeks before this system takes off. We will have an interim period, and this the claims that are being taken right now will be given preference. So just take care of the documentation around this very well, so that we are able, we don't have loss of documents, and also to take care of fraud, because this is what happens, especially when they are manual claims. The other question, yeah, I think I've answered most of them. Dr. Gakombe asked, will the system give unique authorization code which providers can capture in their billing, which can then be captured on the invoice as a bill code? So sort of a reference number. Joy, will this be done?
Yes,
Sort of like a reference number.
yeah, I should. So when you go to the authorization page, you'll see the token that is generated that can be used to reference.
All right, excellent. I think we are coming to the top of the hour, today being a Sunday evening, and I'd like to thank everyone who has attended. We may not be able for sure to answer each question given the time period that we have. However, this particular meeting will be on our website, and Martin, who is assisting me on the KHF side, has given a link where this will be available on our website. When you go to the KHF website and search webinars, you will see something there. So receive our kind regards, and we'll try and keep this up as much as we can. What we are doing is indeed noting the questions and the category of questions that we are receiving from members, and throwing them at SHA for answers. And what you will notice is the bulk of the questions that we got in the last meeting, which was late last week, most of those issues have been answered. For now, let us ensure that all our the credentials, the people who are handling your credentials are sent to the link, and this will be updated on a real-time basis, latest within 24 hours. The PS did indicate that on Tuesday, on or around Tuesday, once most of the contracts have come in, then the listed facilities will be on a newspaper at some point in the week. So just have that in mind. So if in case you see a newspaper with a list of facilities, that is the basis for that. On this call with us today is Dr. Gakombe, and he has requested not to talk, but he passes his regards. He's the chairman of KHF. He's here. Dr. Gakombe, please say hi and possibly close the meeting.
Good evening. Team, I didn't intend to speak because I am here first as a provider, and secondly, as somebody who understands a bit of. I've worked with a team that trying to help with the rollout, claim and benefit administration. I believe that we are making significant progress, and we make significant progress within the coming week. I've had a number of technical questions. Some you've answered. Some I think SHA needs to join us to answer. I think you and I should pursue that agenda so that whatever is not within our area, policy questions, emerging issues are then tackled by SHA Line. That said, I want to assure everybody who's joined us tonight. We are engaged with SHA on a real-time basis. Some of the questions that we did not have answers to, already with the chairman, with the CEO, with the people in benefits and claims, because that's the beauty with the digitization, that we can reach people whenever and wherever. So continue to engage in the various groups. There is a CAF group, there is a RUFA group, there are KHF groups. I want to request each of us to really give us feedback on real-time basis, because it is important to get what is happening at the patient interface, the pain points by patients, the pain points by the staff, manning, or at that front line, because until the front line works, then access will still be a challenge for Jikwa and her sisters. You tackled the subject of payment. Providers will continue to pursue payment of the historical claims. We still have leverage, because if push comes to shove, SHA does not have its own providers, and it is not a threat, it is just a reality. SHA doesn't have providers, the law doesn't allow them to set up providers, and all providers need to be paid, because as we move more and more into UHC, more and more into a pair provider arrangement, as opposed to get paid by the individual patient at the front desk. Cashier's point in the hospital. It basically means that the money is first going into a pool pot, and then get into providers, and then from providers it gets to distributors, eventually to manufacturers. So that interface of the money moving from SHA or private insurance or occupational scheme is an area that will continue to engage to improve. My ideal is where one day we are paid in 4 days. That's my vision. And I know other people moved to that point. The stock exchange moved to instant settlement. I think T+3. The banks moved from 14 days to real-time gross settlement, where I send you money and you see it come in. So it is not beyond our abilities and beyond the capacity of technology for us to be paid T plus maybe 7. So, and today we did ask SHA to start thinking about moving from transaction plus 90 to transaction plus 14, which is where they were at one point when technology hadn't reached where it is. So it is work in progress. The first focus is to ensure patients have access. Coupled with that is ensuring that the money is also flowing, because accessing facilities without medicines, because they are not paid, is really not acceptable. You have gone through this system, but then you find the pharmacy has empty shelves. So it is an ecosystem approach, and we need your support to achieve it, especially in the area of giving us feedback, whether you have credentials, whether you can access the two systems, essentially whether the barriers to giving service have been lowered. So I'm looking forward to that. And I'll stop at that point and wish you all a good night. And a prayer that we wake up to a better day every day for both providers and patients. Asante.
Asante sana, Chairman. I know Lishenga is also somewhere on the call. I just couldn't trace him, but he passes his regards to the entire provider network, Lishenga from RUFA. We are now top of the hour. We wanted it to be short, straight, and brief. It has been lots of questions indeed. Martin, ensure that these questions are summarized and we send them to SHA for answers, and we supply them to providers. To all of you, it's been our pleasure hosting you, right? We will endeavor to ensure that possibly we do this daily for the next maybe 7 days until things are settled, and then now pick it up from there depending on what the needs will be. At KHF, we are on top of this in terms of ensuring that there's a smooth transition, and we will exercise the feedback you give in form of the questions you bring to us and even emails. Please use our email for any questions, and we will transfer that information to SHA for answers. And I hope that we will have easier times ahead. Asanteni na muwe na jioni njema. And thank you, Joy, for being here with us.
Thank you, Doc.